Okay, hi, my name is Dave. I have an order from Dr. I am Jumpy to give patient Skip Rocker, born 1/1/1972, a Pneumovax 1 milligram intramuscularly now. I have checked the medication. It's appropriate for the patient. There is a caution that this could be harmful to someone who is immunocompromised. If I were truly concerned about that, I suppose I could bring it up with a charge nurse or speak to the physician, but I'm going to assume that those issues are not pertinent for today. So I need to make sure that I have the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So I've checked the MAR. I'm supposed to give Pneumovax 1 milligram intramuscularly now. So I would withdraw my medication, Pneumovax, 2 milligrams per milliliter, no cracks, nothing is out of order, doesn't look like it's been opened, it's not cloudy. Now I'm going to check that against the MAR, Pneumovax, 1 milligram intramuscularly now. This is Pneumovax, 2 milligrams per milliliter. So the syringe I'm going to use is a milliliter. It's a 3 milliliter syringe, so it looks like I'll have to do a dosage calculation. I've already done that. I'm going to give 0.5 milliliters to the patient. Patient's MAR says he has an allergy to Celebrex. I don't see the Celebrex causing an issue with this administration. So at this time, I would be ready to uncap my medication, clean the top with an antimicrobial swab. I would clean my surface, my working surface, with an antimicrobial swab. Do some hand hygiene. Going to open my equipment, making sure that I don't touch the needle or the plunger. Prepare my equipment. I'm going to use the double OK method. Going to withdraw 0.5 milliliters of air into the syringe. Going to go through the center of the medication that I've cleaned. Going to inject that, making sure that I'm below the level of the liquid and don't want to be drawing air. Going to withdraw slightly more than 0.5, push any air out. Verify my level. Looks good. Going to use the one-handed scoop method to recap this, making sure to be close to the base. Setting this on a clean work surface. I'm now ready to approach the patient. Once I approach the patient, I'm going to ask him to identify himself using his name band. Skip Rocker, 1/1/1972. Looks good. Do you have any allergies? No allergies. Great. I would explain to the patient that I'm going to give this intramuscularly in the deltoid. I would find that by going 3 fingers down from the edge of the acromion process here, right in the middle of this, making a target area with my hands. It's difficult for me to do, but right in the center of that target area in the deepest part of the muscle is where I would like to go. So with that all looking appropriate, it is now time to go over these 6 rights one more time. I've got the right patient, the right medication, the right dose, 0.5 milliliters, the right route, the right time, the right documentation. Medication, patient, medication, dose, route, time. Yep, looks good. No allergies. Okay. I would now don some gloves. Take an antimicrobial swab, locating my injection site, beginning in the center and working out. Clean that, allowing it to dry. Verify my medication for a third check. I've got Pneumovax, 0.5 milliliters. It is not expired. Pneumovax, 1 milligram intramuscularly now, 2 milligrams to milliliters, 0.5 milliliters, and I've got the right patient. Okay, so using the double OK method, withdraw that non-dominant hand, make sure the site, once I've located it, and I'm going to go quickly at a 90-degree angle. I'm going to aspirate. If I see any blood, I would withdraw this and restart the procedure. There's no blood. I'm going to depress the plunger, administering the medication, withdraw at the same angle. One-handed swoop method for recapping my needle, grasping it low down here. Place some gauze on the patient. I could use a band-aid if need be, if there was a speck of blood. Once that's okay, make sure the patient has no reaction. Withdraw my gloves. Hand hygiene. I would document in the MAR the injection site and the dose, and in my nurse's notes if necessary with facility policy. Barring any questions from the patient, make sure he has a call bell, and let him know to get in touch with me as long as there's nothing else going on. I've been documented. The mess is cleaned up. I've got the medication with me, the sharps, everything's been placed in the sharps, and I'm going to go ahead and leave the patient's room and leave him to enjoy his vaccine. Thank you.